Hi, Andrew. It's Dr. Buford. I'm here with Mitzi. We're just getting started on your left knee. We're looking in the medial or the inside part of the knee right now. Right at the beginning, there was quite a bit of fluid inside the knee. So that goes along with what you've been experiencing. And here we can see some of the reasons why. Look at this articular surface above here. See how this is frayed? That's something that can cause ongoing inflammation and irritation. I don't want to remove too much, but the stuff that's already loose and causing problems is of no value anymore, so we need to remove that. Try and smooth this out a little better for you. Back to stable margins here on the articular surfaces, and then we'll look at the meniscus in a little bit. You can see a little area here that's loose as well in the back. This is still in the weight-bearing portion of the inside of your knee here, so this is an area that still sees a lot of stress as you walk and ambulate. Okay, so we've cleaned out and smoothed out the edges of this defect here. We're going to take some arthroscopic picks and do what's called a microfracture, which is about the best thing we can do right now. Sometimes if that's not effective, we can do a more extensive procedure where we actually transfer cartilage. But that's a more involved procedure. We usually try the microfracture first, depending on the clinical situation. So while we're getting the picks organized, I'm going to have a look at the meniscus. And here's some tearing in the meniscus that we see here. So you get one that turns to the left. And we'll put in basically a pair of scissors here. And we'll trim out the area where we know the meniscus is not healthy. Show you some more in just a minute. Okay, so this is the lateral, push down on the knee a little more. This is the lateral compartment. Things are in better shape here compared to the medial. The cartilage is in much better condition, it's nice and smooth. A little bit of fraying on the meniscus that we've already taken care of, but not as significant as on the medial side. And then we'll come back, we'll look at the notch here. This is where the ligaments in the center of the knee live. The ACL is just behind the shaver here, and then the PCL is back over here. Let me rotate the camera a little bit if I can. So the ACL and PCL look fine. We're going to look at the patellofemoral joint next. Okay, so what we're seeing here is the patellofemoral joint's not in that bad shape. The cartilage underneath the patella actually is pretty good. As you track down the front here, looks like it's in pretty good shape. So we're going to go back to the medial side. And here's our defect here. Here's our little pick. And what we're going to do is get down way at the back. flush a bunch more water through the knee, but I think that'll be, for the most part, the end of the main part of the surgical procedure. So good luck to you now, okay? Bye-bye.